guys read the study in '04 and '05? One was in the Journal of American Geriatrics that revealed that mortality could be predicted by the hyperkyphosis. Did you guys read that? So the more a patient was rounded in the upper back, the sooner they died. They could predict the mortality rate of a patient based upon their posture. And then the other study was in the Journal of Spine, which showed that the more you lost the curve in your neck, or the more that the spine reversed, death came sooner. That most patients experienced no symptomatology. Did you guys ever read those studies? Let me tell you, every single one of my patients gets that. Do you guys put that right next to them when you show them their neck x-ray? You do that? Because I put it right next to their face. And I say to them, guys, what does this mean? When they're looking at their neck x-ray, what do you guys do? You're looking at that. How would you do an x-ray review when you're talking to them? What do you do? I mean, do you say, well, you know, Mr. Johnson, I've been looking at your spine here, and I see that it has a hypolordotic curve. It has some degenerative changes at 5, 6, 7, T1. That's going to cause a radiculopathy and paresthesia down into the arm. And we're going to have to do some adjustments in that area in order to relieve the pressure and so forth. I mean, does that sound familiar to some of you guys? Maybe not. What do? I say to them, I say nothing at that point. I ask them all questions. Bob, what do you see there on your neck x-ray? What do you see? I don't have a curve in there. Exactly. And as a result of that, what's happening to your spine? It's deteriorating. Exactly. And what's that doing to your spinal cord? What's it doing to it? I'll ask you guys. What's it doing? It's putting pressure on it, right? What organs does that go to? Yeah, right, well, whatever. But they're going to look, what do? You got a nerve chart out over here with organs. Guess what you just did to that patient? Are they thinking about their neck and arm pain anymore? No. Should they be thinking about their neck and arm pain so much? No. They should be thinking about the health of the organs, because I have a study right here. Now, let's say they came in with back pain. You ever have one of those patients? They came in with back pain and their neck looks horrific. You ever had those? And they say, well, my neck doesn't bother me at all. Neither did that artery in your heart that was plugged by 70 or 80% before the guy dropped out of a heart attack. Listen, what's the study say? It states right here that you're not going to feel anything until severe changes. You are right there. See, this is what the casualties are, guys. This is just a copy of it. I pull the obits about every month or so in my office, and I show it at the end of my Monday night. I say, guys, this is it. These are the obituaries. This is what it's about in my office. And the neck and back pain that so many of you guys are interested in, that's only a symptom of something more serious developing in your body. That's what it is. It's like you have an arm pain with a heart attack. You want to go to an orthopedic, or do you want a cardiologist right there in a defib? I want the guy who's going to take care of the problem, not the symptoms. Well, guess what? You're looking at him right now. Dr. Joe, let's get you adjusted. How long do you think your problem's been like that? Yeah, 10, 20, 30 years, right? How much of the space have you lost? I got the chart up there with the percentages of decay, right? 50, 75%, exactly. Do you honestly think that it's going to be corrected in a short period of time, or do you think it's going to take a long time? Yeah, how long do you think it's going to take? I mean, you got to ask them those questions. It's going to take a year. It's going to take 2 years. How many adjustments do you think it's going to take? 80, 90, because I talked to them in this case. I'm kind of jumping ahead, but I already talked to them in a group. 80 or 90 adjustments. You got to get them to say it. Exactly right. And if they start going to finances, listen, Bob, I don't even want to talk about finances right now. Do you understand what's going on right now? We'll always work out the financial. What's going on right now? You're dying. That's what's going on right here. And yeah, it's decaying. And yeah, you're getting arm pain and all that other stuff. Now, what do you do? What else do you do? How do you think your neck got like that? How did it get like that? What do you think? Reverse curve, 30 degrees. On average, they probably were what?
Birth,
right. So, Bob, that's right, you were probably born with it. So that would mean it's genetic, right? And I see that you have 2 children. It's probably a good idea that they get checked, don't you think? And you've got to take them and get them to say yes. Now, we already talked at the end of our Monday night that we do a complimentary evaluation on the patient, on any family member.